Warm greetings to all our viewers. Today we delve into a topic that has touched many lives: cancer. This term, derived from the Greek word for crab, is not just one disease, but a collection of over 100 distinct diseases. What unites them all is a common characteristic: abnormal cell growth. Unlike normal cells that know when to stop growing and dividing, cancer cells lack this off switch. They continue to multiply uncontrollably, forming lumps or masses known as tumors. These rogue cells can also invade nearby tissues or spread to other parts of the body through the blood and lymph systems. While the specifics may vary, this general process is what takes place in each type of cancer. The impact of cancer is far-reaching, affecting individuals, families, and communities worldwide. As we begin our journey to understand this complex group of diseases better, we invite you to join us. Before we proceed, kindly subscribe to our channel and share this video to help spread awareness about this important topic. Let's unravel the causes of this complex disease. Cancer is a complex group of diseases, with over 100 types, all characterized by abnormal cell growth. A number of factors play a role in the development of these abnormal cells, and it's often a combination of these that lead to cancer. Firstly, there's tobacco use. This is a leading cause of cancer and is responsible for an alarming number of cancer-related deaths. It's not just lung cancer that smokers are at risk of, but also other types such as mouth, throat, and esophagus cancer. Then there are lifestyle factors. These include obesity, poor diet, lack of physical activity, and excessive alcohol consumption. An unhealthy lifestyle can make you more susceptible to certain types of cancer. For instance, a diet rich in processed foods and low in fruits and vegetables can increase your risk of developing colorectal cancer. Infections also play a role. Certain viruses and bacteria may increase the risk of cancer, such as human papillomavirus, HPV, hepatitis B and C, and Helicobacter pylori. Exposure to radiation, including ultraviolet radiation from the sun, and certain environmental pollutants can also contribute to cancer. Prolonged, unprotected exposure to sun can lead to skin cancer, while exposure to asbestos, certain chemicals and radon gas can increase the risk of lung cancer. Lastly, let's talk about genetics. While most cancers are not directly inherited, certain genetic changes are necessary for cancer to develop. These changes, known as mutations, can sometimes be passed down from our parents. However, most genetic changes occur during our lifetime and aren't inherited. So there's no single cause of cancer. It's usually a combination of genetic factors and external agents. Some causes, like tobacco use and diet, are within our control, while others, such as inherited genetic mutations and exposure to certain infections, are not. Thus, a myriad of factors contribute to the development of cancer, some of which are within our control and others not. When it comes to treatment, there are several options available. One of the most commonly known treatments is radiation therapy. This process uses high-energy particles or waves like X-rays, gamma rays, electron beams, or protons to destroy or damage cancer cells. It's a precise, targeted action that can be likened to using a sniper rifle in a battlefield, aiming to take down the enemy without harming the innocent. Next, we have surgery, an age-old medical practice adapted for a modern nemesis. Surgeons can remove cancer from your body in an operation, but this is dependent on the type and stage of the cancer, as well as the patient's overall health. It's essentially an eviction notice served directly to the cancer cells, removing them from the body they've been illegally occupying. Chemotherapy, another common term you might have heard, uses drugs to kill cancer cells. It's a systemic treatment, meaning it can reach cancer cells almost anywhere in the body. Think of it as a rainstorm, drenching the entire landscape, reaching even the most hidden corners. Then there is targeted therapy, the new kid on the block, which targets the changes in cancer cells that help them grow, divide, and spread. They're more like a smart bomb, designed to seek out and destroy only cancer cells, leaving healthy cells unharmed. Lastly, we must mention palliative care. This is not a treatment to cure cancer, but rather to manage the symptoms and side effects of cancer and its treatment. It's about improving quality of life, providing an extra layer of support when it's most needed. While the journey can be arduous, progress in medical science offers hope to many. Each year, new treatments are being developed and existing ones are being refined. Cancer is a formidable foe, but with every passing day, we're getting better equipped to fight it. Prevention, they say, is better than cure. This certainly applies to cancer. The choices we make every day can play a significant role in whether or not we develop this disease. Let's delve into the various prevention strategies that can help keep cancer at bay. Firstly, steer clear of tobacco. Smoking has been linked to various types of cancer, including lung, mouth, throat, larynx, pancreas, bladder, cervix, and kidney. Even if you don't use tobacco, exposure to secondhand smoke might increase your risk of lung cancer. Next, maintaining a healthy weight can lower the risk of various types of cancer, including breast, prostate, lung, colon, and kidney. Regular physical activity and a healthy diet are two key components in maintaining a healthy weight. Aim for at least 30 minutes of exercise most days of the week and opt for fruits, vegetables, and other plant-based foods over processed foods. Alcohol is another risk factor. While you don't have to eliminate all alcohol, it's best to limit your intake. Heavy drinking can lead to serious health problems, including cancer of the mouth, esophagus, throat, liver, and breast. Vaccinations also play a role in cancer prevention. Certain viruses have been linked to cancer, but there are vaccines available that can protect against these viruses. For example, the human papillomavirus (HPV) vaccine helps prevent most cervical cancers and several other types of cancer, and the hepatitis B vaccine can significantly reduce the risk of liver cancer. Lastly, be sun smart. Skin cancer is one of the most common kinds of cancer, and one of the most preventable. Avoid midday sun, stay in the shade, and cover exposed areas to protect your skin. Wear sunscreen with a sun protection factor (SPF) of at least 30, and keep in mind that sun damage accumulates over the years, starting in childhood. By adopting a healthier lifestyle, we can significantly reduce our risk of developing cancer. Remember, it's never too late to make positive changes in your life. In the world of medical science, research never stops. Let's look at some recent developments in the field of cancer treatment. One of the major headlines that have recently caught attention globally is about an acquisition in the field of cancer research and treatment. The City of Hope, a cancer research center, has planned to acquire the Cancer Treatment Centers of America, or CTCA for short. This acquisition, which is expected to be completed early next year, is a significant step forward. Why, you ask? The City of Hope intends to convert CTCA from a for-profit network to a non-profit organization. This move will undoubtedly increase access to life-saving treatments for numerous patients who might otherwise struggle to afford them. The combined entity will boast an impressive presence with 36 locations in California, along with centers in Arizona, Illinois, and Georgia. This extensive network will facilitate more effective and widespread patient care. But the good news doesn't stop there. The City of Hope is known for its robust research activities. Each year, it conducts nearly 1,000 clinical trials, holds over 450 drug patents, and submits around 50 applications for new drug trials to the FDA. The acquisition aims to accelerate the translation of this research into patient care, potentially bringing life-saving treatments to patients faster than ever before. The impact of such a move can't be overstated. It represents a significant leap in the ongoing fight against cancer, bringing us that much closer to a future where cancer is not a death sentence, but a manageable illness. These advancements in research bring us one step closer to winning the battle against cancer. As we conclude our discussion on cancer, let's remember, knowledge is power. We've understood that cancer is a complex group of diseases characterized by abnormal cell growth that can invade or spread to other parts of the body. We've learned about the numerous causes, from lifestyle factors like tobacco use and poor diet to genetic changes and environmental pollutants. We've delved into the various treatment options available, such as radiation therapy, surgery, chemotherapy, and targeted therapy. We've also highlighted the importance of prevention strategies, such as maintaining a healthy weight, limiting alcohol intake, and reducing exposure to sunlight. In the ever-evolving field of cancer research, we've noted the latest updates, like the acquisition of Cancer Treatment Centers of America by City of Hope, aiming to increase access to life-saving treatments and accelerate the translation of research into patient care. Cancer is a battle, but armed with the right information, we can fight it effectively. So let's continue to educate ourselves and others. Thank you for spending your valuable time with us. Remember to share this video and spread the knowledge. Together we can make a difference.